this office as I was reopening things. I could see where they were. But I want to give you an update on a couple of issues that I think are relevant right now. The first is the issue of testing. As many of you are aware, we continue to have a number of community testing sites that are available for people who are asymptomatic. Who are symptomatic, people who are showing symptoms. And we've talked about that over the last few days. We still have one site at UMOS, which is 2701 South Chase Avenue, where we have asymptomatic testing, and the demand there continues to be high. It is our hope and our intention of having a second site that we'll be announcing hopefully within the next day or two on the north side. It will not be at Midtown, but we're looking at a second site there as well. The reason that we have made this pause, as we've described it, is there have been some challenges with getting the test results. And I can tell you that that's happening and having an impact right here firsthand. These tests are not performed by the city of Milwaukee. They're performed by the National Guard, and they're sent to a private lab in Madison for the testing. Because the demand was so great, I think people were surprised at how difficult it was going to be to turn around the test as quickly as people had hoped. So to those individuals who are waiting, I apologize for that. Obviously, we wanted to get this testing back as quickly as possible. But these are not tests that are processed in our City of Milwaukee Health Department. Again, it's a contract between the state and this vendor, and they're working very, very hard, and we're working with them to get that information into the system, into the state system, so that we can let people know. Again, the reason I know this is an issue is because a lot of people are calling City Hall and asking for the test results. And just like you, we want to get those results to you as quickly as possible. A large group felt that it was putting people at a disadvantage if they were being tested and were not getting the results as quickly as they should. So as we reload, if you want to call it that, we want to make sure that there's a quicker turnaround time for those tests. That's something that's very important to all of us. But our intention is to continue to have all of the community testing sites in place in the next, basically by the beginning of next week, if that's possible. That's what our goal is right now. We still have the sites, the community tests, the community health center sites and the hospital system sites that are operating, and there's a large number of those throughout the city of Milwaukee and the Milwaukee area. Later today, we'll continue analyzing. We've already begun analyzing the data over the last week or two as to whether we can move to the next phase in reopening businesses. Most of the businesses are now reopened, but you still have limitations of 10 for a number of businesses. And we know that that's a concern among restaurants. We know it's a concern among bars. We know that churches are concerned about that. So we're going to analyze that data later today. And again, we'll have that announcement as soon as that data is completed, hopefully by tomorrow. The last thing I want to talk about again, because I think it's pretty relevant, is we have known that there will be two parts to the COVID pandemic, a health crisis and an economic crisis. Locally, we have to deal with both of them at the same time. And evictions are a big part of this. Evictions and foreclosures will increase throughout the state and region because that's what happens in hard times. I was glad for the state's moratorium on foreclosures and evictions in March. With that ending this week, we know that this issue is very, very real. And we know that people are being affected by this in a very real way. So what we're trying to do is we need to work together to get us through this challenge. I was pleased that Fannie Mae and Freddie Mac have already implemented forbearance of up to 90 days for both residential and rental borrowers. I understand locally Bank of America has been offering similar terms. Some banks have offered forbearance of 90 days, but with the full balance due after 90 days. I will be spending time in the coming weeks with bankers and housing counselors to work on getting ahead of these issues, similar to how we convened the Milwaukee Foreclosure Partnership Initiative in 2009. But locally, we have allocated $4.2 million in CDBG funds to emergency housing and support for those who are homeless or who are at risk of becoming homeless. And that will support shelters and rapid rehousing for those who need a home to let them stay safer at home. The $25 million rental assistance funding from the state will be a great help. We're working with the Social Development Commission locally to finalize the workings of that program. Locally, we have identified at least $4.9 million in home funds and CDBG funds to help with rental assistance. I've also asked HUD for a waiver to use those home funds for rent assistance and was very pleased that they're allowing that. We're also working with FEMA to determine if we can allocate disaster aid to help renters and hope that will provide additional capacity as well. The goal is to provide several months of support for families with a temporary reduction in income and to do that through their landlord. So we'll continue to develop that effort and hope to launch it soon. Our housing authority began contacting tenants in March and April and have relaxed their late payment guidelines to accommodate those having a hardship. So a lot of work is being done, and we're going to continue to deal with all these issues on different fronts. So with that, I'll turn it back to you, Catherine.
Thank you, Mayor Barrett. Next, we'll hear from County Executive Crowley.
Thank you, Catherine, and thank you, Mayor Barrett. Good afternoon, everybody. I hope everyone is continuing to stay safe out there, especially as we begin to warm up. I am not a doctor, and so I just want folks to understand that if they do decide that they want to go out, that they're taking the necessary precautions to keep yourself safe. So that means to continue to wear a mask whenever you can, making sure you wash your hands, and please continue to practice physical distancing while still making sure to stay social with many of our family, friends, and neighbors. It's extremely important, Today, I also want to address myself and Chairwoman Marcelia Nicholson released a statement expressing our frustration with the state of Wisconsin of our denial of Milwaukee County's request for funding as a result of the COVID-19 crisis. And I kind of want to explain the source, which is, originally Milwaukee County was slated to get about $165 million from the Treasury Department. But based off of funding allocations, they basically ended up giving that money to the state of Wisconsin. So once $103 million was cut from our original allocation, the pot of money that was increased at the state level by the same amount. And so, the cost that we're providing right now already far exceeds the revenue that we currently bring in. And so we are already seeing, again, about $100 million lost in revenue by the end of this year, and estimated to see about a $450 million impact total to the budget. When you think about, we've also seen the greatest loss of life with 264 deaths and nearly half the state total, even though we're only a sixth of the population. And I guess to say this, the one thing I will say is that we're more so frustrated because we think that while we talk about being fair and equally funding many of the municipalities who have been hit by COVID-19, I think this was a prime example of where we should have applied equity at. And so making sure that those who have been hit hardest by the COVID-19 pandemic are getting the necessary resources to make sure that we not only get over the pandemic, but get on a good road to recovery. And so throughout the course of this pandemic, Milwaukee County is going to continue to provide the services. And we're going to have Jim Matthew later on to talk about many of the critical service that we provide at Milwaukee County. So with that said, I'd like to pass it over back to Catherine.
Thank you, County Executive Crowley. And as you just noted, we will now hear from County Board Chairwoman Nicholson.
Thank you, Catherine, and thank you again, County Executive David Crowley. I'll dig in just a little bit deeper on his initial point. So first of all, thank you for having me today and giving me an opportunity to speak on the recent CARES Act allocations. At the board, with the support of the County Exec, we're working to re-envision and remake county government with the goal of achieving racial equity. We want to become the healthiest county in the state, so we'll continue to seek directive, flexible aid from our allies. But as County Executive Crowley mentioned, at the board level, we are also frustrated at the rejection to give us that direct and flexible funding that we need. And what I want viewers to understand is that this just isn't a money grab for us. We requested an amount that is equitable to the uniquely high costs that we have incurred at Milwaukee County, and also the amount that Congress had intended for us to receive. Let me be clear, without these additional aids, that will account for the higher costs in Milwaukee County, our residents, especially people of color, will continue to suffer an unjust burden, and racial disparities in health will continue to get worse. The need for county services has increased significantly as a consequence of COVID-19, and this has impacted Milwaukee County residents and communities of color at a higher rate than anywhere else in the state, and it will continue to do so for the foreseeable future. I want to be clear again, in Milwaukee County, nearly 78% of all COVID-19 cases impacts people of color. Milwaukee County has been the most impacted by COVID-19, accounting for nearly half of the entire state's deaths due to the coronavirus. The costs of providing the critical services related to the pandemic are shocking and are intensified by the economic downturn. We already only have so many options in terms of revenue and raising revenue, and this is only getting worse as time goes on. And it's going to cause a significant strain on our budget. As you know, the county has to adopt a balanced budget, and that means if we don't get the funding that we so desperately need, service cuts are inevitable. So with our continued partnership with the county executive, our eyes and hopes will remain focused on our federal allies and the upcoming work of Congress. And hopefully we can get the direct and flexible resources that we need to respond to the crisis. Thank you again.
Thank you for joining us, Chairwoman. Next, we'll hear from Dr. Ben Weston.
Thank you. Good afternoon. First to the numbers, we have 7,182 cases of COVID-19 in Milwaukee County and 268 individuals who have died. As we look at our online public-facing county dashboard, we see that we now have more cases in our Hispanic population than any other race or ethnicity. 2,383 confirmed positive tests. We can also see from our map that the south side of the city of Milwaukee has and continues to be an area with a focus of these cases. It's important to preface this with the fact that we are waiting on a large number of tests from the south side of Milwaukee National Guard testing site. And as this data comes in, it'll certainly lead to increased understanding of the true burden of disease in that community. At the same time, we've seen and heard of particularly high rates of COVID-19 in Hispanic communities across the country. I think it's easy to stigmatize and make assumptions about a community, and specifically one that faces historical discrimination and institutional disparities. Another view, and I would say a more accurate perspective, is that perhaps the higher burden of disease in our Hispanic community is due to the high number of essential workers. Essential workers with jobs that provide low pay without opportunity for sick leave when you have a cough, or unemployment if you're not able to show up. Jobs that require many folks to leave the home and interact closely with the public. We hear the term essential workers often, and I think it can start to blend into the background. However, essential workers are deemed essential because they're on the front line every day so that everyone around them can live their lives. Rather than stigmatize, we can work to gain understanding of the burden of disease in the Hispanic community and provide resources. I know that our Milwaukee Health Department and surrounding health departments and the 16th Street Community Health Centers have been at the forefront of providing these resources and continue those efforts. As we see the expansion of cases in sectors of our community like this, and really in the entirety of our community, as well as those communities that surround Milwaukee County, we can approach our everyday activities in a different manner than we have previously. We've adapted to staying at home, and now we must shift to adapt to safely leave our homes. With each activity you do outside of your home, you have to be creative and thoughtful in your approach. Can it be done outside or in open air? Can it be done from a distance? How can you minimize shared objects touched? And is it possible for everyone to wear a mask? Like it or not, these are the questions we must all ask on a daily and often hourly basis as we move into a new way of thinking, a new approach to our everyday lives. And this is how we can get back to a new normal and do our best to keep ourselves, keep our loved ones, and keep our communities healthy. Thank you and stay safe. And I will hand it back to Catherine.
Thank you. Appreciate it, Dr. Weston. Now we'll hear from Darren Rauch.
Good afternoon, everyone. and thank you for joining today. It's my pleasure to join from the City of Greenfield Health Department, where I am one of 11 health directors in Milwaukee County. Today, I'm happy to provide data updates from the COVID-19 epidemiology intelligence team, that's been working with countywide data for the past several months. I'm going to go ahead and share that data report now, as well as highlighting some of the data as Dr. Weston already has. I will just give one caveat from the start. This data was last pulled on Tuesday to allow time to prepare this report. So some of the data here in terms of overall numbers will not match what Dr. Weston had shared previously. But definitely one of the prevailing themes that we've seen and heard in this press briefing already is that case counts continue to climb. Figure 1 here shows a daily number of COVID-19 cases in Milwaukee County, and we see a steady increase pretty much from about the middle part of April through present day. When we look at this data over a 7-day average, it smooths out some of the bumps that we see in the daily data. And again, you can see very much easier a discernible increase from mid to late April through earlier this week. And this flattening could represent a flattening, or it could represent just some tests that are still waiting in the queue and waited to be reported on. So we need to continue to monitor that in the coming weeks. So cases are going up, but notably deaths are going down. So figure 3 here shows a downward trend in deaths, looking at daily deaths. And again, when we look at that averaged over 7 days, we see a discernible trend downward with several little peaks here, but generally in a downward trend. We've talked about growth rate before, and figure 5 looks at the cumulative case growth rate, comparing Milwaukee County to the state, to the Waukesha, Ozaukee, Washington, WOW counties. And currently we see a current doubling time in Milwaukee County of 23 days compared to a 17-day doubling time in the WOW counties and 19 days for the state. We see that played out here in figure 6 as well, where we see the trend in doubling times is widening between Milwaukee County and the state. And I think that shows that there's significantly more disease, more COVID-19 disease in the state in the recent month than there has been in the past. We have tracked transmission rates, also known as the R value, for the last several weeks. And while the R started out very high in the early weeks in March, since early April, it has dipped down to an R of 1, and it has basically hovered a little bit below and a little bit above 1 over the last several weeks. Currently, it looks like our R value or transmission rate is 1.0, which means for every 1 positive COVID case, we expect to identify 1 additional contact who will turn positive with COVID-19. This reproductive number or transmission rate is important to look at the spread of disease in our community, and there's definitely been spread in our community in the recent weeks. We continue to track a number of demographics to paint a picture of COVID in our community. Last week, we added median income, and the median income data here in the top left continues to demonstrate that the lowest income quartiles have the greatest amount of COVID-19 disease and the highest rates. In the top right, you see we've made some recent changes in how we graph this data. We're now graphing all 18 and under in this pink color, but we discernibly see the highest number of cases in the 18 to 39 age group, followed by the 40 to 59 age group. So we're seeing a lot of young adults with COVID-19, which is particularly worrisome because that's different than what we've seen in the past, and that change has happened over the last several weeks. In race and ethnicity on the bottom left, you do see that the Hispanic population has surpassed the African American population in Milwaukee County as the leading population that's burdened with COVID-19 disease. And then lastly, we see a male and female distribution there. We see very similar trends when we look at hospitalizations. But in hospitalizations, we see that the highest number of hospitalizations is in our older adult age range, specifically those 60 to 79 years. And we do see that hospitalizations are slightly higher in the white population. For deaths, similarly to hospitalizations, we see the highest number in the 60 to 79 year age group. And deaths overall are highest in the African American population as a cumulative number, but it's certainly been increasing over the past several weeks in the white population. We've been monitoring testing coverage very, very carefully to make sure that we're meeting certain test metrics. And as Mayor Barrett noted earlier, there has been a lot of testing that's been done. And because there's been a lot of testing done, there's been a delay and a backlog in some of that data. So on this graph, we reflect week 10 in red because this data is still preliminary. We do not have all of the test results into the system as of yet. We do believe that the majority, if not all of those test results will be negative because the preference is to grab the positives and start working on those for case follow-up. But we're seeing a lag here because of that data backlog and some slowness with getting that data into the system. And that's a statewide issue. It's not just a Milwaukee County issue. You see here, we are also tracking percent positive. We certainly have percent positive trending in the wrong direction. It's trending upward, and it's something we're going to continue to monitor as those test results come in. Lastly, I'll show you the two spatial maps, just looking at COVID-19 incidents in Milwaukee County. Specifically, this particular map is looking at all cases of COVID between March 12th and May 26th in Milwaukee County. And you can see very easily there's very, very few neighborhoods or locations in Milwaukee County that have been spared from COVID. And then even more specifically, if we drill down into what's been happening over the last week between May 20th and May 26th, as Dr. Weston and I mentioned talking about the data, we see a heavy, heavy concentration of cases in the southern suburbs, largely in the southern part of Milwaukee and the southern suburbs, and probably predominantly impacting large areas that are Hispanic population. So lastly, this data continues to show that COVID is not even close to over in our community. As County Exec Crowley mentioned, we need to continue to be vigilant about what we can do to keep ourselves safe and others safe throughout the community to stop the spread of COVID-19. Staying home when possible, wearing a face mask, and keeping physically distant is just as important now as it was in March and April when COVID was really running rampant. Thank you very much.
Thank you, Darren. And now we'll hear from Jim Mathey.
Thank you, Catherine. Good afternoon, everyone. So I'm going to touch mostly on the issue of evictions. Thank you, Mayor Barrett, for your comments earlier. The city of Milwaukee and Milwaukee County are very aligned on this issue, and we see it as a major problem coming up. So to start with the county resources, the past 2 years or so, we've had our own eviction prevention program that was beefed up in the 2020 budget, luckily, where we're able to provide housing navigation services and eviction prevention resources to a very targeted population. A lot of the CARES Act funding and federal funding can only be used for individuals that do not receive any other federal source of a subsidy. So our county dollars are going towards individuals in our Section 8 program and in our homeless rental assistance programs. They pay 30% of their income towards rent. A lot of our individuals have very severe mental health issues, long-standing homeless issues. So we're really concerned about them not being able to pay the portion of the rent and being evicted and returning to homelessness. So our county resources are going towards those populations. We've already reached out to many landlords that are involved in our Section 8 and our homeless rental assistance programs to find out who's late on their portions of the rent and see if we can proactively ensure those individuals remain in housing and not be evicted. As Mayor Barrett said, the city of Milwaukee is contributing significant resources, as is Milwaukee County from similar federal funds. CDBG funds from the county, as well as our home funds, are going towards tenant-based rental assistance and eviction prevention. So that's very important. We are still trying to find out resources from the state. This is going to be a heavy lift, I think, from the city and the county. We expect thousands of evictions. we have seen a big difference in the homeless population. Our division continues daily homeless outreach. Street homelessness is the lowest we've seen it since we've started doing street outreach. I think that's due to two reasons. Number one is the stay on evictions has made a big difference in our community, as well as the hotel program that the city and the county have partnered on. We have about 100 individuals who had been homeless that are in our hotels. We're going to need significant resources as well to get those individuals placed into housing and not go back on the street. So we're working in partnership with the city to ensure that everyone has housing plans, and a lot of those individuals do have a significant eviction history as well. So we're also partnering with a lot of nonprofits. So I'd like to mention some of those as well. Individuals that need legal assistance, and this is landlords as well. I think that's an important point I want to get across. So the eviction crisis is, we're certainly concerned about all the low-income individuals and families that we serve, but a lot of smaller landlords, this has hit significantly as well. So these resources aren't just for tenants, but landlords as well. So Mediate Milwaukee is doing free mediation services, so that is available now. As well as for tenants, Legal Action and Legal Aid are providing eviction resources. We partner with the Eviction Defense Project with Legal Action. And we want to make sure that individuals are reaching out to these organizations now. There's no reason to necessarily wait till the last minute. If you know you are going to need resources, to be proactive is the best way to approach this. Community Advocates also has a rent helpline for individuals that are behind on their rent in order to avoid evictions. Mayor Barrett mentioned the state rental assistance program that's being activated. So SDC will be in charge of those funds. You can start filling out your online applications with SDC now as they work to implement that program. So again, I think we're all trying to be locally as proactive as possible. This will be a heavy lift for our community. Again, this will be thousands of evictions and they will be upon us shortly. And it's going to take all of us working together to ensure that individuals and families can stay in their homes. We don't want to go backwards on all the progress the city and the county has made on homelessness recently, but the eviction issue could change that around quickly.